You actually can't limit it to such a broad spectrum because we're tackling a lot of letters. There's the L, there's the G, there's the B, there's the T. What's up, everybody? My name is Dr. Deano Reyes. I am an LGBTQ health and sexual health specialist here in Metro Manila, and I am the doctor at Pulse Clinic Manila, which is located in Makati City. In my practice, what I've learned is that the LGBTQ population has unique biopsychosocial experiences that a normal doctor won't necessarily be able to understand. That's why it's good to have doctors that are also part of the community, because there are certain languages and experiences that you can only really understand when you actually live it out. So for example, in our clinic, I get to talk about dating apps, Grindr, bathhouses. I get to talk about experiences that are unique to the LGBTQ population that other doctors might not necessarily relate with. I think the barriers that LGBTQ people experience vary per country. Taking it close to home, in the Philippines, since we are a predominantly Catholic country, definitely the issue of religion and how people see LGBTQ individuals come into play. Discrimination or stigma definitely has a big role in preventing LGBTQ people from acquiring the healthcare that they need. So in our clinic, we really emphasize the ability for us to give a safe space. So from the moment that our patients talk to us over the phone or over social media, to the first time they enter the door with our receptionists, up to our closing with the doctor's consult, we make sure that every step of the way we are non-judgmental and offer a safe space. A lot of my patients have horror stories where they go to other institutions where they're already judged on the receptionist level already. So we try to eliminate that and provide as safe of an environment and as accepting of an environment as we can possibly make it to be. You actually can't limit it to such a broad spectrum because we're tackling a lot of letters. There's the L, there's the G, there's the B, there's the T. So for example, for lesbians, sexual health is definitely a factor, but a lot of lesbians are actually notorious for not seeking the healthcare needs that they're supposed to, such as getting their pap smears done, getting their mammograms done. A lot of lesbians are also more prone to diabetes, being overweight, obesity, and things like that because they don't get themselves checked. For the gay population, of course, we have to talk about the dynamic of sexual health because while not generalizing, we know that the gay population, the MSM population, are very prone to HIV and STIs. So it's important to get yourself screened regularly, entertain the possibility of initiating PrEP if you think it's right for you, and overall having them armed with as much information about sexual health as possible. Then, of course, we have our transgender community where we go into the entire dynamic of having gender-affirming hormone therapy. We talk about the dynamics of that, what that means for them, side effects, what to expect. And all in all, I think something that puts a linchpin into the LGBTQ population is a solid foundation on mental health. Because with our experiences as LGBT, it's hard to separate the mental health aspect from your normal daily experiences. People really have to, doctors, conventional doctors and healthcare providers really have to understand that mental health is very important for the LGBTQ population. In the terms of people who are not gender binary, in terms of people who are transgender or non-binary, it's its own entire care spectrum in itself. Unfortunately, currently in the Philippines, it's not that mainstream yet. It's very good that a lot more younger doctors are able to offer these services, but personally, I had to learn this on my own, signing up with the World Professional Association for Transgender Health. I had to learn this on my own because it wasn't taught to me in med school. So it's a specific skill set that should be integrated, if possible, into the medical schooling curriculum because gender-affirming care is life-saving care. And the entire aspect about the gender identity and SOGI is very important because you have to be able to communicate to your patients and understand what their SOGI is and what's the best way that you can help them. So in terms of the policy issues, definitely right off the bat with your IDs and your personal identification, you are limited to how you were born, the gender you were born, which causes issues with people who don't fit into the conventional mode of male or female. There are certain aspects, there are certain endeavors that are trying to help with that, but that in itself is already a small thing, but it's a big deal for them. Then we have to go into the entire concept of gender-neutral bathrooms and things like that. What are the policy issues that get in the way of LGBTQ population? So definitely, right off the bat, your personal identification is already an issue that a lot of LGBTQ people experience, especially those who don't conform to the binary gender identities. You are limited with your IDs to the gender you were born with, which you might not necessarily identify with. So that has some dysphoria. Of course, there's also aspects with regards to medical decision making. For example, lesbian or a gay couple who's been together for 20 years can't legally make the decisions for each other or their potential adopted children in the future. So those things actually get in the way. What can we do? Of course, we have to talk and communicate and have these conversations with the people in power to integrate what it means to be LGBTQ, what SOGI means into the day-to-day of people so that these issues can be addressed.